Hey guys, good morning, good afternoon, good evening, wherever you are. And guys, today let us talk about prostate cancer. So, uh, before I talk about prostate cancer, let me tell you, if you have not subscribed, you are missing a lot on this channel. So guys, make sure you subscribe, like, share, comment, and most important thing, don't forget to turn your notification bell so that every time I post a video, you will be the first person to be notified. So guys, straight away, let me define what is prostate cancer. So prostate cancer develop in the prostate, and prostate is a small walnut-shaped gland located below the bladder and in front of the rectum in men and people assigned male at birth. This tiny gland secretes fluids that mixes with semen, and it keeps semen healthy for the conception and pregnancy. Prostate cancer is a serious disease. Fortunately, most people with prostate cancer get diagnosed before it spread beyond their prostate gland. So treatment at this stage often is usually to eliminate cancer. So let us look at some of the types of prostate cancer. So first, if you are diagnosed with prostate cancer, it is most likely adenocarcinoma. So adenocarcinomas start in the cells of the glands, like your prostate, prostate that secrete fluids. Rarely, prostate cancer form from other types of cell. So some of the prostate cancer which are less common are small cell carcinoma, transitional cell carcinoma, neuroendocrine tumor, and sarcomas. So how common is prostate cancer? Maybe you are asking yourself, can any male or can any person assigned male gender at birth can he get a prostate cancer? So prostate cancer is common, second only and let me say prostate cancer is common, second only to skin cancer as the most common cancer affecting men and people assigned male gender. Yeah, it is the second after the skin cancer of cancer affecting the male people. So that is it. Now, the most common thing that also the most important thing that we are going to talk about are the symptoms and the causes. So what are the symptoms of prostate cancer? How can someone tell that they have a prostate cancer? Early stage prostate cancer rarely cause symptoms. So these issues may occur as the disease progresses. So those are the symptoms that I'm going to talk about. They can occur as the disease progresses or as the disease continue to affect your gland. So number one is a frequent and sometimes urgent need to pee, especially at night. Frequent and sometimes urgent need to pee or to urinate, especially at night. Weak urine flow or flow that start and drop. Pain or burning when you are urinating, or we call it sometimes dysuria. Another sign, loss of bladder control, which we know as urinary incontinence. We also have loss of bowel control, and that is fecal incontinence and urinary incontinence. And then we have also painful ejaculation and erectile dysfunction. So if you're experiencing painful ejaculation and erectile dysfunction, you should go and check yourself so that maybe you might be suffering from prostate cancer. We have blood in the semen, and we can also call it as hematospermia. Hematospermia. And also we have pain in your low back, hip, or chest. Those are some of the signs and symptoms that someone who is suffering from prostate cancer will present with. So somebody might ask, are prostate problem always a sign of a prostate cancer? The answer is no. Not all growth in your prostate are cancer. Other condition that causes symptoms similar to prostate cancer include benign prostatic hyperplasia, prostatitis, among other conditions that can affect your prostate. Now, what are the causes? That is also another important thing that we should know. What are the causes of prostate cancer? Experts are not sure what causes cells in your prostate to become cancer cells. As with cancer in general, prostate cancer forms when cells divide faster than usual. So while normal cells eventually die, cancer cells don't. Instead, they multiply and grow in a lump called a tumor. As the cells continue to multiply, parts of the tumor can break off and spread to other parts of your body. And that one we'll know as we will say that cancer has metastasized. Don't know how to pronounce it. So luckily, prostate cancer usually grows slowly. Most tumors are diagnosed before the cancer has spread beyond the prostate. Now, prostate cancer is highly treatable at that stage. So what are the risk factors for prostate cancer? Who is at risk of getting prostate cancer? Age is one of them. Your increase in age, as you get older, you get high risk of getting prostate cancer, especially if you are over 50 and above. We say that is 60% highly. You are at high of getting prostate cancer when you are 50 plus years and above. Now, races and ethnicities, you are at risk greater. You are at a greater risk if you are a black or you are African. I don't know the reason why each and every bad disease they usually relate or associate with the black and the Africans. I don't know, we were cast before we were born. I don't know the reason why. And then family history, if you have anybody from your family or who has ever suffered from prostate cancer, you are likely 3 times to get prostate cancer. Genetics, you are at greater risk if you have other cancers from other parts of your body. You can also get prostate cancer. Some studies have identified the prostate cancer risk factor, but the evidence is mixed. Other potential risk factors are like smoking, if you have prostatitis, if you have a BMI of greater than 30, that is when you are having obesity, if you have any sexual transmitted infection, because especially HIV and AIDS, because of the immunity is low, so your body cannot fight against other infection. Also, if you are exposed to some agents that are harmful to your body. So about the diagnosis is prostatic specific antigen blood test. The prostate gland make a protein called protein specific agent, and this one will be taken to the lab and they will see if you have if you have prostatitis or if you have any cancer in your prostate. Also, we have digital rectal exam. Your provider insert a glove lubricated finger into your rectum and feel your prostate gland. So if it is a bump or hard, bump or hard areas may mean that you have cancer. So if it is hard, if it is having bump, then it might be automatically that you have prostate cancer. We have the biopsy. This is during a needle biopsy, a healthcare provider remove a tissue sample for testing in a lab for cancer. And also we have the imaging, an MRI, magnetic resonance, or rectal ultrasound. This will show if you have the cancer in the prostate. Management, the best management are the surgery and radiotherapy. You may receive radiotherapy as a standalone treatment for prostate cancer or in combination with other treatment. So we also have hormonal therapy. The hormone testosterone boosts cancer cell growth. So hormone therapy uses medication to combat testosterone role in fueling cancer cell growth. So the medicine work by preventing the testosterone from reaching cancer cell or by reducing your testosterone levels. Or alternatively, your provider may recommend surgery to remove your testicles so they can no longer make testosterone. So the doctor will decide which surgery is best for you. Also, you can do chemotherapy, or they can do chemotherapy uses medicine. Chemotherapy uses medicine to destroy cancer cells. You may receive chemotherapy alone or with hormone therapy if your cancer has spread beyond your prostate. We have also immunotherapy. Immunotherapy strengthens your immune system, so it is better able to identify and fight cancer cells. So you as the healthcare provider may recommend immunotherapy to treat advanced cancer or a recurrent cancer. Okay, and then we have the targeted therapy, or we can say mutation therapy that turn health cells into cancer cells to prevent them from growing and multiplying. So targeted therapy, it will help zeros in the genetic cells that turns healthy cells into cancer cells to prevent them from growing and multiplying. So we have so many other therapy. The doctor will recommend which one is best for you. Prevention of prostate cancer is not possible. Still, taking these steps that I'm going to talk about may reduce the risk. So the first one, you get regular prostate screening as your health provider. How you will get to screen based on your health factors. Maintain a healthy weight because obesity is one of the risk factor of most of the cancers. Get regular exercise, and then also eat nutritious food. There is no one diet to prevent cancer, but good eating habit can improve your overall health. Quit smoking and alcohol, because tobacco, if you smoke, you are making your cells, the body cells, to mutate or to change, and therefore you might start developing a cancer. So those are how this prostate cancer can be managed. I'm sorry, my voice is too low, but I will do auto-generated text or you will see what I'm trying to say in the text, so on the video. Guys, if you've not subscribed, kindly please, I don't know what you are waiting for, because we have a lot of content coming in. And also I want to say that for the longest time you're not going to see my face on this video, so most of the video which are not lifestyles and vlog, you might not see my face, so get used to that. I think that is what I want to say. Let's meet in the next video. Bye till next time.